And I remember a couple of weeks ago, a young man came with his wife to our coffee, and he was a veteran. He had been in a coma for 6 months after one of these IEDs had exploded while he was on patrol. And he had a gash down the middle of his forehead. And he was blinded in both eyes. And the bottom half of his face was entirely disfigured. And he had lost the use of one arm and one leg. 25, 26 years old. And he was with his wife. And as he described to me the difficulties they were having negotiating with VA bureaucracy and the treatments that he had been receiving, and I listened to him when I looked at his wife and looked into her eyes, and as she was describing the adjustment their daughter was making and how she had hugged and loved her daddy, but also understood that things weren't going to be the same. And it reminded me of what we all have to know, that politics isn't a game, that it's not a sport, that the decisions that are made have consequences. And if you want to know why we're here, it's because everybody in this auditorium, I hope, has made a decision that we are going to take this country back, and we are going to create the kind of politics that serves every person and every veteran and makes good decisions on behalf of those who have been asked to sacrifice on our behalf. That's why we're here. We are here because solutions are within our reach. The problems we face are not insurmountable. We know what to do. We know that the healthcare system is broken, but we also know that we spend $1.9 trillion a year on healthcare. And that if we take the money and spend it more wisely, we can make sure that every American has a basic healthcare plan. We can put more money. We can put more money into prevention so that children aren't going to the emergency room to get asthma treatments. That is the most expensive care you can get. We can make sure that those with chronic illnesses are getting regular checkups and care, because 20% of the patients cause 80% of the costs. And if we manage their care better, we can save money. We can institute medical technology and so that we have electronic billing and medical records are kept that way. And we can get all these savings and make sure that everybody has access to affordable care. In fact, I want to be held accountable right here and right now. At the end of the next president's first term, at the end of my first term as president, we will have health insurance for every single American. Yes, we can. We can do that. We can do that. We know what works. We know what works in education. If we invest in early childhood education and give our children a good start, there's no better investment that we can make. We can start paying our teachers better. More flexibility in the classroom. And ask more of our teachers because they want their children to succeed. We know models that work to teach every child, not just some children. What's been lacking is not good ideas. What's been lacking is the political will, a sense of urgency that every child can learn.